Hey everybody, welcome to an amazing Nacho TV show with my good friend, Nacho sponsor, co-founder of RipeGlobal, Dr. Lincoln Harris. We're going to meet him in a few minutes, but before we get started, I'm going to share some fun and free nacho toppings with you if you'd like to survive, thrive, and not cry in the real world of dentisting. Whether you're a dental student or a new dentist, or even a medium-aged dentist, we put together an amazing guide for you. Just text SURVIVE to 215 543 6454. Text SURVIVE to 215 543 6454. I'd love for you to share in the Zoom chat where you are watching in from. If you're watching this on demand, just shout at your screen where you're from, and I'll hear you wherever I am. This is being Zoomed, live streamed live tonight. It also will be available on demand. We'll tell you how you can get that on demand as well. So this is our guide to surviving, thriving, and not crying. Dr. Lincoln Harris has put together an amazing teaching team. One of those people on his team is Dr. Michael Frazis, and he did a phenomenal course on doing better first, faster, second crown preps, better first, faster, second. He talks about scanning, he talks about retraction, he talks about prep design, he talks about insert. To watch this totally for free, just text crown to 215 543 6454. I've seen hundreds, if not thousands of hours of on-demand C, and this is one of the best that I have ever seen. If you're looking to hire an associate or need help finding a job, our sister company, Dentist Job Connect, can help. Visit dentistjobconnect.com or just text hire to 215 798 9897. And if you are a D1, a D2, a D3, the day to start looking for your job after dental school is day one of D1. Yes, that's day one of D1. To look, apply 12 months from when you finish your D4 year or your GPR year. But start looking now, start scrolling. It's totally free to check out. Just go to dentistjobconnect.com. And if you'd like to see a list of over 250 available jobs across the US, we have ones that pay over $300,000 a year. We have ones with mentorships. We have one in New York City. We have ones in Texas. Text job to 215 798 9897. My co-star tonight is Dr. Lincoln Harris. I had the honor of spending time with him in Savannah, Georgia, just this past weekend. Link is someone who I have looked up to, and I have to share this both metaphorically and literally because he is 100% taller than me, but I am 100% funnier than him. And I have to say it is tougher to be funny, or you just grow tall. You don't have to do much at all to be tall. But Lincoln is the co-founder of RipeGlobal. They are solving one of the biggest problems, if not the biggest problem, in dentistry, and that is dentists getting better at dentistry, dentists getting better at their communication skills, their confidence level, and we're going to hear from Link tonight. So Link, you're welcome to start your video if you're ready. If you are not ready, I will continue to share some of my wisdom with funny material. So just if you give me a sign from behind the Zoom screen, Link, do you need a few more minutes?
I can't start the video because it says the host has stopped it, so you'll have to.
It sounds mean of me. Like, here, Morgan Bellis, can you help me? I don't know what I did different before 5 minutes ago. Let's see. Oh, I see what I did. Hold on. Let's see. Link. Morgan Bellis, I might need you to help me. Let's see. I'm in the panelist mode. Here we are. More. Lincoln Harris. Start video. Let's see. Try now, Link. Does that help at all? Can you start your video now?
Not yet.
Morgan, I'll make you the co-host with me a second.
Perfect.
Let's see if I can do. I always go down to more. They're always so serious about it. Allow panelists to unmute themselves. I check that.
There we go. I'm good.
Okay, good. He's here. He is here, Lincoln Harris. So, Link, I'm going to turn the presentation over to you. Then we have questions from the audience, but we have many people Zooming in live with us, so you can ask questions in the Q&A. So I'm going to stop my share. I will be back on later, and I'll let you share your screen, and we'll talk about your presentation. As Link is getting ready to share, I would love for you to put in the comments. We're all here together. It takes 2 seconds to type on your phone. What is your biggest clinical concern after dental school? Being too slow, not completing procedures with confidence, having the dental team be worried that you're going to take too long and make them run over at the end of the day, please put in the chat what is one of your biggest clinical concerns. We have people watching from Cleveland. I know MD, awesome. SS from Boston, awesome. So Link, I'm going to let you talk. I'll interject when the time comes to interject, but I'm turning it over to you.
Awesome. Is my screen sharing okay?
Yep, we see a beautiful fountain. Is that what we're supposed to see?
Absolutely. So I know that you're a big fan of GPRs, and I think that they're an amazing idea. And I was talking to the previous dean of Harvard Dental School, and he was telling me that about 15% to 20% of dentists can actually do get into a GPR. So that means, and he said there's like about 30% of the people, if you take the military in the United States and GPRs, that accounts for about 30% of general dentists, about 25-30% go into specialties. And that means there's about a third that currently don't have a position in a GPR and aren't doing specialist training. So now, why? I think the first thing is it's underappreciated why this is a problem. And the reason why it's a problem is that dentistry, through an accident of history, has been separate from the rest of the medical field, even though we are a surgical specialty. We are a surgical specialty, just like ear, nose, and throat surgery, like ophthalmology, like gastroenterology. But mostly we're trained for about 4 years, and the rest of them are trained for somewhere like 10 or 12, and they spend most of that time in a hospital doing hundreds and hundreds of operations, so that they're kind of competent when they graduate and able to do high-value procedures. And dentists are not. So all of the things that have high hourly rates, you can't do when you graduate, like implants, like multiple units of ceramics and all of these things. So what does RipeGlobal do? We help you get from where you graduate to where you want to be about 8 to 10 years faster. I mean, you can go the slow way if you want, and I'm telling you, the slow way is more comfortable. It just doesn't get you where you want to be as quickly. So it's kind of like pulling a plaster off slowly. Now, let me see if shivers. Now I've shut the whole thing. Don't know what's happening.
I still see the fountain. While Link's getting ready for that, I am a huge fan of GPRs and AGDs, but Link is 100% right. There are not nearly enough programs across the U.S. for all 6,000 graduates. So I see now. I see your desktop
right
now, Link.
Hang on. Let me just do a stop and a start. Righto. Start again. Okay. There we go. Share done. So sharing. We back.
There we go. Dr. Cat. I see Dr. Cat.
Yeah. Okay. So just to give you a little example of this, Dr. Cat, actually, she immigrated to another country, started in Russia. She went to another country. It's very difficult to go from a place where you charge $100 for a crown to somewhere where you charge $1,000 or $1,500. And so it actually takes a lot of, it takes a long time to build your confidence. And a lot of people, you'll see this a lot I see it a lot in New York City, where people immigrate to the United States from somewhere in South America or something, where they're used to things being quite low cost. And then suddenly in this big competitive city, and they're trying to do, the highest level Western dentistry, it's very difficult.
Right. The skills that I've learned from FRD in the previous 2 modules actually made me far more comfortable in doing everyday procedures. I gained skills. I knew how to do things before. I had the theory behind me, but I actually lacked experience in doing that. So I wasn't as confident in proposing these solutions to my patients, which resulted in me doing far less crowns and far less complicated cases where I would do a quarter at a time. So now, because I know how I feel when I do that, I know what can go wrong and how to solve that. So it makes me far more confident. And then I tend to propose to do that to my patients more, which actually makes my days go faster, me feel better, and definitely it made my revenue better.
So the whole story there is there's a whole range of programs in the world that are trying to tell you how to make money and how to sell and how to have communication. But at some point, you actually need the clinical skills to back that up. Otherwise, it's not stable. So if you are a super confident dentist and you don't have the skills to back it up, what will happen is you'll be confident until you either get sued or you have a dental board complaint, and then your confidence will evaporate. So you have to have the skills to back it up. And so there's a whole range of things when you have skills that also result in you earning more. So if you do the right thing as a dentist, you also earn more. And that's because when you do like more difficult things in life, you get paid more than for easy things. So if you do difficult cases, they're worth more. And even if the hourly rate is the same, it means that one case fills your entire appointment book for maybe a week of time. And then when you present with confidence because you know in your heart that you can do this procedure, your acceptance rate goes up. And then if you're well trained, your time goes down because good preps don't take a lot of time. Efficient, good preps are very fast. If you don't know what you're trying to achieve and you're not efficient, then they take a very long time. And sometimes the longer you take, the worse they get. And then if your patients are unhappy, then you are doing refunds, which is both emotionally disastrous and also financially disastrous. If you have complications, they cost a lot to fix. And then the result of getting all of these clinical things right and having confidence is that you can actually increase your production very dramatically. So I've seen quite a few of the people that we train, their production has doubled, tripled, even in some cases gone up 4 or 5 times. Now, if
Link,
you
go back there for a second. Link, I want to ask you a quick question. Go back to that slide because it's great. I want to get a picture of you and on this slide. So I have multiple associates and I was an associate. So I'm speaking from both sides of this. The efficiency per tooth, you know, in my practice, I have these amazingly motivated, awesome associates, but when they are taking so much longer than a crown prep, I've learned Link's language, everyone. US, we call it the practice owner. He calls it the practice principal. So when he says principal, he's not talking about school, he's talking about the owner dentist. But when I say to a patient in a hygiene exam, hey, I would like my associate to help you with this crown, you know, your tooth will benefit from a hard hat for your tooth. And it takes the associate so much longer than the principal dentist. What's the impact, whether it's on patient confidence, team confidence, associate confidence? I like this efficiency per tooth. Before we move on, just kind of deepen our understanding of that.
So there's 2 aspects of efficiency per tooth. It's actually better for the tooth. So the longer you take to prep a tooth, the more inflammation you get. And then the second part is there's basically not a single aspect of life where you pay more to go slower. So you want fast internet, you pay more. You want to do a fast flight with less stops, you pay more. If you want to, you know, back in the day, they had a Concorde, you paid more for a smaller plane, actually, like a Concorde wasn't that comfortable. So everything in life, you actually pay more for it to be faster. And that also goes for dentistry, that people will value, they will pay. It's not that they go, oh, well, I want to get my hours, you know, if I'm going to spend this much money, I want to sit in the chair for at least 5 hours so I get my money's worth. It's not a buffet at the hotel. This is getting your tooth done. It's uncomfortable. The sooner you get it over and done with, the happier the patient will be.
Thanks for clarifying.
And so, like, if you want to ramp, there's a couple of things. Some of this is not to do with the associate. Some of it's to do with the practice owner. So there's a few things I'm going to go through. One is that you have to remember how you started yourself. You have to remember where you started yourself. You have to think about your own return on investment and return on capital. These are quite different things. You have to remember what it's like. So you can't sell something until you've done it. You have to do it the first time to sell it. If you're an owner, you need to feed the associates. If you're an associate, your owner needs to feed you, or you're not going to develop. And I'll explain what that means. And if the owner has any sense, they'll make the job so good that you can't possibly leave, because setting up your own office will be more difficult and worse. So the first aspect is, if you're an owner, you have to remember how you were. And this is a problem because it can often be 20 or 30 years since you were a new dentist doing new stuff. This implant with all the bone loss was done by me 10 years ago. Now, to be fair, it lasted 10 years, but now there's pus coming out. And so if I can make that sort of mistake, then when I'm training my associate to do implants, I need to expect them to do it too. So, and then that brings to another thing, which is if you are an owner. Now, as an associate, you can't control this. You need the right sort of environment. You need an environment that's supportive, because if you're an associate, you will get patients complain about you to the principal or to the owner. And if you're an owner, people will complain about your associates because they've got 2 years experience or 1 year and you've got 30. So, and 30 years is not 15 times 2 years, it's probably about 40 because the number of repetitions you do in the last year of practice is about 10 or 20 times higher than in the first year of practice. In an office, if the DAs are like writing the associates because the brand new associate's not as good as someone who's got 35 years of experience, that can be very difficult. And everyone gets complications, including me. In fact, your complication rate somewhat stays the same because as you get more experienced, you just get more difficult cases. And you might then go, like, what does Australia know about America anyway? Because you're all different. You have insurance. I've been to the United States about 40 times. Almost all of my training's been done there. The biggest proportion of our dentists that we train are in the United States. I've been on Dental Town as an admin. I've listened to people complain about insurance since 2006. You know, the complaints on Facebook and Instagram today are the same as they were 20 years ago. They haven't changed. But we have a whole bunch of people that we train, like Fozia, who's in Chicago, in the northern suburbs of Chicago. She opened her own practice, fee for service. Her acceptance rate of treatment has massively increased. Her income has increased, and she's gone from doing single teeth to doing full mouth rehabs, and now she started implantology. So, and then we've got Chip. Chip's been a dentist for 20-something years. He's done rehabs all his life. He's been to Pankey, Coy, Spear, and everyone you can imagine. Did 2 years of training with us. Was able to drop all of his insurances and also increase his income about 15%. And then Brett is from Arkansas. He complained to me a little while back that he went from like being booked 2 weeks ahead to being booked 3 months ahead. And this is how stressful it was for him because his patients were accepting at a higher rate. So he went from like 50 to 80% acceptance rate. And they were also accepting full mouth rehabs and aesthetic cases instead of single crowns. So it just takes up a lot of chair time. It really fills your book.
And Brett, Link, I want to interject. Go back to Brett for a second. I want my team to share this because I interviewed Dr. Brett, and he's a practice owner. He said he wishes he did RipeGlobal earlier so he could get the ROI earlier in his career. Now he's a PPO dentist that does full mouth rehabs. He's someone who even he shared on Facebook the other night that he didn't do enough CE early in their career. Whether it's participating in RipeGlobal, everyone will get a follow-up email. Morgan and Jill put Dr. Brett's video in it. If you could put Dr. Brett's video in the chat, if one of you find it, that's great. But just talk to this audience, and many of them are dental students. So I know here, one of them whose name starts with a B might be running 10 miles while he's listening to us tonight. These are many dental students here. So they have debt and they're overwhelmed, and they say, where am I going to find the time and the money to invest in my career? Tell them why they should, tell them the risks of not doing it, tell them more about Dr. Brett.
I can probably actually best explain with Dr. Presh, so let me just jump ahead. Okay. So Presh paid 20 grand to do a 2-year restorative course. Okay. Now you could go to like a brand name American Institute and pay 80,000 if you want to. He didn't. Now I talked to him just 2 months ago and I said, Presh, what's been your return on investment on this 20 grand that you invested? He said about 25 times in the last 2 years. It's allowed him to increase his income whilst taking a 6-week vacation for the first time in his life. He can actually afford stuff like all the new loops and the equipment that he wants. And in his case, don't listen if you're a practice owner, but because he was in a practice that wasn't feeding him, he can now go, hey, I can afford to buy a practice. So that's his journey. And that's just one example. And so the cost of not doing training is literally hundreds and hundreds of thousands, maybe even millions of dollars. Like for this guy, he probably earns $200,000 a year more every single year from that. So if you go over if he'd delayed 5 years, it's cost him $1 million. Most of our students are able to pay for the course if they do the work. Okay, this is the little asterisk. If you don't do the work, you will get no result. If you do the work as required, most people increase their income enough in the first 3 months. There's 2 asterisks. One is you have to do the work, and secondly, you have to be in a practice that supports you. And if you're not, talk to Paul and he'll find you another one.
Yeah. Now, Blink, let me just add a couple stories. Additionally, Dr. Nathan Adias, one of my favorite dentists who's come to all of our CE, met you at our course, and he said it's allowed him as a solo practice owner to be able not stay late at the end of the day, fit more emergencies in, get home to his family on time. So we talk about the impact on money, which is awesome, but the morale portion. What is it through training with RipeGlobal that's allowed Dr. Nathan to see more emergencies in the same amount of time, to process more patients? What magic does RipeGlobal share with these dentists to allow them to do things like that?
The big thing is that we actually train people for skill, not practical theory. What's the difference? If you go to a regular hands-on course, you're going to sit there and you will spend all day doing one crown prep. Like you'll do the occlusal reduction, and then you'll have morning tea, and then you'll have a lecture. And then by the end of the day, you've done one crown prep in 8 hours with a buffet lunch. That's not realistic to anything. Whereas when we train you, it's like kind of boot camp. We go do a crown, okay, do another one, do another one. You've got 10 minutes, do another one, do another one. Okay. And we're giving you the time pressure, and it's realistic, and you're using your own equipment and all of these things.
And I just want to highlight, this is all done in your operatory, where you practice dentistry with your equipment, your composites. And that's truly the magic of someone who's been a dentist, trained dentist, has associates. Sitting at a Holiday Inn, picking up an implant model on the table does not replicate real life. So back to you, Link. I just wanted to highlight that.
I mean, it's like going to the shopping mall and sitting in the little airplane that you put like $1 coin or something in, and then thinking you know how to fly a plane. If you want to learn to fly a Cessna, you should probably train in one, not in something completely different. But once you've done the training, you still have to do the procedure for the first time, and then you get stuck in this trap. You can't sell it because you haven't done it, and you can't do it because you haven't sold it. And the way you get around that is you have to have someone who gives you cases. So this is a case I gave to my associate, or you get your mum or your uncle or someone, or you do an ad on Facebook or something. So I gave this case, it's a complicated case with ortho and restorative, to my new associate. He's only in his second year out of school. And it's kind of complicated, but I talk him through it. He's stressed, but he will get through this, and he'll have done a multidisciplinary rehab in his second year out. So, that's going to boost him dramatically going ahead. This is another case. I did the surgery, passed it to my new associate. He did the restorative for the all-on-4, which is, it's a scan and then you get paid, and it's quite a good hourly rate for basically doing a scan and screwing a prosthesis in. This is Dr. Cat from the very start. And, she finished restorative with us and then immediately moved into implant training. So she had never placed her own implant about 8 weeks ago, and I just saw that she's placed 1, 2, 3 arches of all-on-4 in private practice at full fees already.
Wow.
Like that's paid for her entire implant course already. So now, if you're an owner, associates, and you can't just employ them, you have to build them. So if you're an owner, you need to get your associates doing basic stuff. If you want to get them when they're fairly new out of school, like first or second year, and then you get them starting with doing scans for smile designs. That's the best place to start, because it's training you to think about rehabs and aesthetic cases. And then all of the simple stuff just to build your skills. And then as soon as you can, you want to move even young docs. I don't like this theory that they have to be old and bitter and have done 5 years of Medicaid before you can teach them anything. That's just nonsense. Get them into doing quadrants and then anterior and aesthetic cases and rehabs and implants as soon as you can. Yes, you'll have nasty complications, but you get them anyway. You just might as well get it over early in your career and move on. I'll just give you a little video because people don't understand how it's possible to learn in your own chair. It's way better. Dentists learn more than 50% faster this method, and this little video just shows you how it actually happens.
Introducing the RipeGlobal Fellowship, a dental mastery course to help you take your skills to the next level. Fellowships have been designed for individuals at all experience levels. Whether you have just graduated or have been in the industry for 10 or 20 plus years, we deliver our fellowships online to give the best learning experience and best education possible from dental educators across the globe. The courses run for 1 to 2.
Okay, that's frozen. I'll just quickly run through it here. So we have all of the lectures up front, so you can learn everything you need to know, and then you have hands-on training that's done in your own chair with your own kit And that allows you to have the same ergonomics, the same materials, the same handpiece as you're going to use in your own chair. So when you go from training to teaching your dentist, you go from training to treating your patient, it's exactly the same procedure. So it's so much easier than working on a bench top in a hotel, which is nothing like your patient. So this is Dr. Kat. She's working here doing one of the exercises, and then you can see how similar it is to treating a patient on Monday morning. So that process, and then there's case presentations to make sure that you know how to do the skills, and so you feel confident in yourself. There are a community that's available 24/7.
Well, I think that's what I want to point out. So when I interviewed Dr. Yanni Polak and I asked him why he did RipeGlobal, you guys should put this on every one of your marketing pieces, because he said the most magical thing. So everyone listening in here live and on demand later, Dr. Yanni Polak is a 2016 grad. He bought an existing practice. And I said, why did you invest $20,000, $18,000, $22,000? Why did you spend time in your own office after hours? And he said, I wanted to do right by my patients. Jill put his video in the chat. Everyone should watch it, because that's what we all want to do right by our patients. But what he said, Link, was he loved the ability to access the instructors at any time. Tell our audience more about that before we go to the Q&A. People can scan this QR code for a special Nacho Ripe deal. But he said, I can access the instructors almost at any time. I can ask questions. I can learn from them. I don't feel alone with them. Tell this audience how that works, how you created something so magical.
So we have our own platform that is separate to social media. So on social media, Paul, I think you can attest to the fact that it's very difficult to get people to be nice on social media. They like to fight. They like to be nasty. Our own platform is only people doing our courses. That means they all have the same struggles. And so they know that they need to be kind because they've been through the process. And that means that there's two things. First of all, RipeGlobal has like 60 teachers all around the world. Now, that means that at any given time, there's probably one of them online. And then the second thing is there's hundreds of students all around the world. So at any given time, probably one of them will be online to give you feedback. So if you have a question, then you can do that. Now, if you scan this code, first of all, you'll get a couple of free lectures from me. And secondly, if you go onto the website right now, you can save 20% on our major courses if you register before the 28th of February.
Put the actual link in the chat, Morgan and Jill. So this was awesome, Link. I have some questions that were submitted to us. So if you could stop share for a minute, we'll put this link directly in the chat. So first I want to ask the questions of the people that are here, the two awesome dentists. I said, what are some of their clinical concerns? So even if this just reinforces what you said, so not being fully competent for a difficult procedure. So talk someone through, is that a normal concern, and how does RipeGlobal help them overcome it? How have you overcome that in your own career?
So the lack of confidence and competence is 100% the biggest problem for getting case acceptance and everything. So we train you to be competent. That's what we do. And the way that we train is completely different to almost any other course that you will do, because we do massive repetitions until you can do it without thinking. So like if we're teaching you crown preps, we're going to do 17 in a day. If we're teaching you full arch preps, we're going to prep the entire upper arch and make temporaries in about 4 hours. And then you're going to do the lower arch next week. So that is trying to make it as realistic as possible, not some, artificial thing. Once you've done that, and then you have to do a case presentation. And now this is where dentists all come up with the excuses. I can't find a patient. No one's to pay for it. That's why you do your mum, you do your uncle, you do someone that you know, do an ad on Facebook saying 50% off rehabs or aesthetics or veneers or whatever it is. People go mad for that stuff. It's crazy. Like they will boast that you treated them when you weren't competent. They will literally say, I was their first patient, which is, it's crazy. So lack of competence coming out of school is 100% normal. You are trained to do about 6% of dentistry when you graduate. I worked it out. And so it's not that it's weird that you're lacking confidence. It would be weird if you had confidence. Doing this fast. We train you to be good and to be fast through massive repetitions. Now, there is some things you have to do slow to start with to learn how to do them well. But most things, if you do enough repetitions, you can be fast. Or if you learn to do it perfectly, and then you have to do it to a more basic level, you'll be like a race car. Okay. Lack of trust from the team and patients due to age. So the age thing you can't fix, unless it's one of those prank videos where you like wear an old person's mask and then you act like a young person. But if you're competent and you act confident when you talk to the patients, you talk to the people around you, they will have trust in you. And part of this is because there's a whole bunch of things where the dental school has trained you basically as wrong as you can possibly imagine, like presenting options. Presenting every option is how you make patients confused, you make them upset, you make them stressed, because the reality is when you go to a doctor, you want them to make a recommendation. Now, that's a whole different thing. That's a whole different subject, but the reality is giving people all the options is both wrong legally and it's wrong from the success of treatment planning.
Let me interject. Someone asked from the audience a very good question. We'll go back to this list and spend 10 minutes. Please, everyone who's here, you're here with Lincoln Harris and I. I don't want to brag, but I did not make it into the NBA. I don't know what Link's childhood dream was, but we did manage to grow between the two of us a 55,000 member, and Link has a 90,000 member Facebook group. So you're looking at two people who have 145,000 people attached to dentistry paying attention to what they do. So please use this as an opportunity to ask a question that's on your mind to either of us. But how do I push myself if the owner dentist doesn't do the procedures? If I want to get better at endo or another specialty procedure, but they don't do it, what happens if I get in trouble? Who can I rely on?
So there's probably two parts to that. The first one is just accept that things are going to go wrong in your career. There's nothing you can do about it. Now, the reason it's so painful early in your career is because when something goes wrong, you always think it's because you didn't know enough. And then later on in your career, when it still goes wrong, now you know it's not because you don't know enough. Shit happens. Okay. So now, if your owner doesn't support you when through a difficult period, call Paul. That rhymes. Got to call Paul. Get a new job. Okay.
You don't even know there's a popular show, Better Call Saul. So, and what Link is talking about is the owner dentist has to have your back. Doesn't mean they have to know how to do every single thing that you do. In fact, it's actually valuable to be able to offer one skill. Let's say maybe it's surgical extraction and socket preservation and implant placement. Maybe it's clear aligners, which Link and his team teach. I think that's a wonderful thing to get involved with and have someone you can go to. How about just some general tips on transition to private practice, hygiene? You told me that you stopped writing your own notes and your assistant helps you. Any tips to streamline your day in addition to the clinical stuff, from checking your hygienist or what you call therapist, note writing?
We have hygienists too. We have both. I just like to talk about therapists because it makes you all jealous to have a hygienist. Stuff like note writing, you can't implement if you don't own the practice. So if your practice owner doesn't help you implement note writing. So in my practice, the dental assistants write everything that everyone says. So there's literally the full conversation typed down. And so that's something you can do if you're the owner of the practice. If you're the associate, you kind of got to fit into the culture that they have, and then you've got to do a change management process. The things that will help the most is, number one, actually setting a plan for your career. So I'm going to have a planning session on careers soon. So go to my link, make sure you're already logged into the RipeGlobal website, and then
Morgan and Joe, we're going to put the link for Link's free courses and the RipeGlobal site through the Dental Nachos sponsorship in the chat. Just go and copy and paste it right now. So keep going, Link. I just wanted them to make sure that they were doing that.
You will get where you want to go about 10 times faster if you actually make a plan, even if the plan is wrong. So even if you don't like it later, just having something is better than nothing. So that's number one. Number two, there is no way to avoid discomfort in dentistry. Dentistry is very uncomfortable until you're really competent. So you can either do this two ways. You can either drag out your training so that you're just moderately uncomfortable for about 25 years before you feel good, or you can accelerate your training so that you're more uncomfortable for like 2 years, and then you get to the point where you're comfortable like 18 years earlier. So the total amount of discomfort you will suffer to become really good and competent is going to be the same. It's up to you whether you do this fast or whether you drag this out for half your career. Up to you. Okay. My advice is get it over and done with fast because your career is so much more fun. Third part is make sure you're in a good environment. If you are working for someone and they're really stunting you, don't just put up with it. Got to call Paul.
Well, that Job Connect is striving daily to connect you to the right job. If you want to connect with us, just text job to 215-798-9897. We're going to wrap up in the next 5 minutes. Link, you only have 2 minutes and you might have courses on this, but since you did it by mentioning it to it, and these dentists are here on Zoom with us, you can just expand about why providing too many treatment options causes a patient to lose confidence and potential legal concerns if you provide too many. You only have a short version. They have to follow you on, go to your site to watch more, but they're here. So I'll give them a little more link wisdom on that.
Okay, so this is going to offend everything you ever learned at dental school, but legally, regardless of what the patient chooses, you are legally responsible for what they chose to do. So you may as well only offer things that you know will work. So when the patient comes in with their root split and their post-core crown in their hand, and they say, can't you just, and nothing good ever follows the sentence, can't you just?
Yeah.
Can't you just put it back in for my wedding tomorrow? The answer is no, I can't. Okay, don't give that option because that option will fail tomorrow during the wedding.
That actually, I want to share with you, Link. If I had heard, you've helped me in my career in many ways. If I heard that as a new dentist, because I work with my amazing dad and his partner, but they did have some patchodontistry in them. And it's also, guys, I just want to share with you, a 57-year-old dentist who's seen a patient for 30 years who does something that's heroic, the patient views it much differently than a 27-year-old they just met, because it's all about relationships. So what Link just told you about can't you just and refusing that is absolute gold. Only put things on your menu that you're comfortable, that you know will work. And it's okay not to be everyone's dentist. That's, even though we're talking about clinical dentistry, Link, that is true gold. We're going to wrap up in a minute, but just tell us about Dr. Michael. He's given some courses. What's his role in the RipeGlobal training with the restorative portion?
Okay, so Michael is actually the head of restorative training, and he's the head, actually I think he's the head of all education. So my role is I help design the courses, and then I also have to do a whole bunch of business stuff because I'm one of the founders. And so Michael is focused purely on education, and he helps us design our courses. And because we have so many students in so many countries and our courses are running all of the time, our ability to fine tune the way we train people to get better and better over time is just constantly iterating. So we don't have to wait 2 years to make a change. We can basically improve it every 2 months. And so he and I work very closely to do that. He's got a great video on how to do faster crown preps, and his work is immaculate. So just because it's fast doesn't mean it's bad. It can be beautiful and fast.
I love that. Well, we're going to wrap up. I'm so thrilled we had 3 times as many people watching in as our last one for new dentists. If you could go into the chat, everyone, Link and I put our timer, and just put one thing you learned over the past 30 minutes that will make you think different tomorrow. One thing that has inspired you. One thing that motivates you to be a better dentist. The 2 of us had none of this when we were new dentists. 0. I had a Hotmail account and 4 friends. There were not people. Link is in Australia. I'm in Center City, Philadelphia, sharing with you. So I'd love if you just, as we wrap up this webinar, share one thing in the chat that you learned over the past 35 minutes. One thing that you want to do different tomorrow. One thing that inspires you to do better. And please grab the link from Link. That joke never gets old. Before we go. So real growth comes from extreme discomfort. Link, you talked about this weekend. Real growth comes from extreme discomfort. That's the marathoner. Shocker, he wrote that one. Don't offer something that you know will fail is gold. My teams, you can grab these and take a picture of them. How to talk with the owner dentist about being more successful. Thank you all. It's okay to be uncomfortable.
Yeah, I don't think
so those are awesome shares. Well,
extreme discomfort is probably a little bit far, but you are going to be uncomfortable. Rapid learning is uncomfortable. So if you're really comfortable, you're probably not going anywhere. And that's kind of sucks, you know. It's it's like going to the gym. It kind of hurts, but then you feel good the rest of the day. If you don't go to the gym, then you just feel bad all day because you didn't feel, you didn't do something at the start. So
I love that. Great dentists are built, not found. So Link, as always, thanks for sharing with us here tonight. In Australia, I will let you get back to your midday. It's the end of the day time here. And everyone watching in, please check out everything that RipeGlobal does. I'm honored to have them as a partner and sponsor. And Link is one of my BFFs. Thanks so much, Link.
oh, can't wait to see you again. I'm sure I'll be in the state.
Awesome. Enjoy, Link.
Okay, catch you later. Bye.